Today I'll be discussing tuberculosis, or TB. In Afghanistan, TB remains a significant public health challenge globally, and Afghanistan is one of the countries with the highest burden. Each year, approximately 13,000 Afghans lose their lives to this disease. WHO 2015. Multiple factors contribute to the spread of TB in Afghanistan, including socioeconomic conditions, ongoing conflict, and inadequate healthcare infrastructure, SR 2022. In 2021, there were an estimated 76,000 TB cases in Afghanistan with 12,000 deaths, USAID 2023. This presentation will explore the geographical area, historical perspective, epidemiology, societal and economic impact, treatment options, prevention programs, cultural considerations, and the involvement of international organizations in tackling TB in Afghanistan. Afghanistan is a country with a population of approximately 38 million people, World Bank 2022. It has been significantly impacted by ongoing conflict and instability, which have severely affected its healthcare infrastructure and public health outcomes. The World Health Organization reports that Afghanistan has one of the highest TB incidence rates in the Eastern Mediterranean region. Poor living conditions, malnutrition, and limited healthcare access further exacerbate the spread of TB. In 2020, the Ministry of Public Health reported 50,000 new TB cases with 10,000 deaths, SR 2022. Addressing these socioeconomic and environmental factors is crucial for controlling TB in Afghanistan. Tuberculosis globally. Now, let's shift our focus to the global impact of tuberculosis. That TB is one of the top 10 causes of death worldwide and is the leading cause from a single infectious agent. 8 countries account for 2/3 of the global TB burden: India, China, Indonesia, the Philippines, Pakistan, Nigeria, Bangladesh, and South Africa, WHO 2021. TB spreads through the air when people with active TB cough, sneeze, or talk, making it highly contagious, CDC 2021. In 2019, an estimated 465,000 people developed multidrug-resistant TB, or MDR-TB, Global Fund 2021. This form of TB is more challenging to treat and requires extensive medical intervention. To combat TB, the World Health Organization has launched the End TB strategy, which aims to reduce TB deaths by 95% and cut new cases by 90% between 2015 and 2035, WHO 2021. Global initiatives like these are critical in the fight against TB, aiming to save millions of lives and reduce the burden of this infectious disease. Historical perspective of TB in Afghanistan. TB is an ancient disease with evidence found in Egyptian mummies dating back to 3000 to 2400 BCE. It was known as phthisis in ancient Greece, described by Hippocrates and Aristotle. The term tuberculosis was coined by Johann Schlein in 1839, and Robert Koch's discovery of Mycobacterium tuberculosis in 1882 revolutionized TB understanding and treatment. In Afghanistan, historical data shows 65,000 cases and 11,000 deaths in 2016. In 2018, there were 48,420 reported cases. The COVID-19 pandemic disrupted TB management, reducing treatment coverage. Additionally, stigma and gender inequality hindered timely diagnosis and treatment. Significant milestones include the introduction of the BCG vaccine, the development of streptomycin, and the implementation of the DOT strategy. Epidemiology. The epidemiology of TB in Afghanistan is complex. The epidemiologic triangle consists of the agent, Mycobacterium tuberculosis, the host, which includes vulnerable populations such as women, children, the elderly, and malnourished individuals, and the environment characterized by overcrowded living conditions, poor ventilation, and limited healthcare access. In 2014, there were 58,000 new TB cases, with 56% diagnosed. Drug-resistant TB is a significant challenge, with over 1,200 cases reported in 2014. In 2020, it was estimated that 73,000 people had TB in Afghanistan, indicating significant underreporting. Impact on society and economy. TB has profound socioeconomic effects in Afghanistan. High mortality and morbidity rates disrupt economic productivity. Women are disproportionately affected, leading to significant social and economic burdens. The healthcare system is strained by the dual burden of TB and COVID-19. Financial isolation and reduced international aid further strain the healthcare system, limiting resources and capacity to address TB effectively. Addressing these impacts requires comprehensive strategies to improve healthcare infrastructure and economic stability. Treatment options and recommendations. Current treatment strategies for tuberculosis in Afghanistan include the DOT strategy and GenExpert technology for diagnosis. However, there is a need for improved healthcare infrastructure and training for healthcare workers. Community engagement and education are crucial to reducing stigma and improving treatment adherence. Multi-drug-resistant tuberculosis remains a serious challenge, with over 1,200 cases reported in 2014. Recommendations include strengthening healthcare facilities, ensuring a consistent supply of tuberculosis medications, and enhancing the capacity of healthcare workers through training and support. Prevention programs. Prevention programs in Afghanistan need to adopt a population-focused approach. Early detection and widespread tuberculosis awareness campaigns are essential. Improving access to diagnostic and treatment services can significantly reduce tuberculosis incidence and mortality. Addressing socioeconomic determinants such as malnutrition and poor living conditions is also critical. USAID aims to detect and treat 80% of estimated multi-drug-resistant tuberculosis cases by 2025. Community health workers play a vital role in active case finding, contact tracing, and treatment supervision. Cultural considerations are crucial in addressing tuberculosis in Afghanistan. Gender-specific healthcare access issues need to be addressed as women face more barriers to diagnosis and treatment. Community education programs can help combat stigma and encourage timely healthcare seeking. Collaboration with local leaders and the use of culturally appropriate materials and awareness campaigns are essential. Traditional beliefs and practices should be respected while integrating modern medical approaches to ensure community acceptance and adherence to tuberculosis prevention and treatment programs. Involvement of WHO and other organizations. International organizations play a vital role in tuberculosis control in Afghanistan. The World Health Organization is committed to supporting Afghanistan's national tuberculosis program, providing technical assistance and facilitating access to quality tuberculosis services. USAID's strategic plan aims to increase tuberculosis case notifications and treatment success rates. The Global Fund's support has been critical in managing drug-resistant tuberculosis and providing necessary resources. Continued international collaboration and support are essential to sustain tuberculosis control efforts amidst political instability and economic challenges. In conclusion, addressing tuberculosis in Afghanistan requires a multifaceted approach that tackles the disease from various angles. As highlighted, the country faces significant challenges due to ongoing conflict, instability, and socioeconomic factors that exacerbate the spread of tuberculosis. The key strategies must include improving healthcare infrastructure, enhancing the training of healthcare workers, and ensuring a consistent supply of tuberculosis medications. Community engagement and education are crucial to reduce stigma and improve treatment adherence. Involving local leaders and utilizing culturally appropriate materials can aid in overcoming cultural barriers and misconceptions about tuberculosis, especially in rural areas. The role of international organizations cannot be overstated. Continued support from the World Health Organization, USAID, and the Global Fund is essential in providing the necessary resources and technical assistance to combat tuberculosis effectively. The collaboration of these organizations helps manage drug-resistant tuberculosis cases and sustain tuberculosis control efforts amidst Afghanistan's political and economic challenges. By addressing both the medical and socioeconomic determinants of tuberculosis, Afghanistan can make significant strides towards reducing the incidence and mortality rates of this ancient yet persistent disease. Ensuring comprehensive strategies that include early detection, improved access to diagnostic and treatment services, and robust prevention programs will be key to achieving long-term control and eventual elimination of tuberculosis in the region.